into the clinical features of PCOS, it's important for us to understand what goes on, what happens before you start getting those signs and symptoms of PCOS. But remember, like I said, it's down to two things: excess androgens and ovulatory dysfunction. But here is the trick about it. Everything about PCOS, right? You have intrauterine factors. So when the baby is still in the womb, there are certain factors that are present that predisposes the baby to having PCOS later on in life. Secondly, there's what congenital virilization. So what happens is that there's excess of male sexual characteristics in an individual assigned the female gender at birth. The third thing is there is postnatal factors, and the key player here is insulin resistance, right? And the trick about insulin resistance here is that you can have resistance at the level of the liver and other tissue, but in the ovaries remain sensitive to insulin, and because of that, the ovaries continue to produce androgens, which is the male sexual hormones. Like I said, you have three things: heritable traits. So one, maternal PCOS. So if the mother has PCOS, there is that already is a risk factor for the child to have PCOS. You also have some genetic factors. The second thing is, like I said, intrauterine factors, right? I'm talking about congenital virilization, and like I said, virilization is about an excess of male sexual characteristics in a baby originally assigned the female gender at birth, right? The third thing is